All right, so we get to look at the concept of glucagonoma. Now, glucagonoma is something I want you guys to actually what understand very well. Like some of my other videos, I always tell students that you can come over and watch and watch and watch. But for glucagonoma, I want you guys, as you are watching, you are understanding. Now, glucagonoma, from the word glucagonoma, you can get to what? Coin out the word glucagon. Now, when you coin out glucagon, you proceed. What is the use of glucagon? Glucagon is a hormone that is produced by the pancreas to keep increasing glucose levels, while insulin is basically trying to reduce the glucose levels. Do you understand? So glucagon and insulin are basically what? The opposite. So if you are saying there is glucagonoma, that means there's a glucagon producing tumor. That means there will be elevated levels of what? Glucagon in the body. You get? So if there's elevated levels of glucagon in the body, then you want to look at things like the effect, that's the symptoms and the rest of it. All right. So let's define it. We said that glucagonoma is actually a rare and slowly growing tumor of the pancreas alpha cells. Right. So this will lead to what? Excessive glucagon production. All right. So what is the characteristics? Typically, a glucagonoma is what? Benign. 90% of it is benign. All right. 90% of glucagonoma cases are basically benign, and just 10% will usually progress to what? A cancer state. The average side is usually what? 5 to 10. So we are saying glucagonoma it actually is a tumor that will affect the pancreas, leading to what? Elevated levels of glucagon production. Right. So it's usually solitary and it's usually located in a pancreas tail. Just like here, you could see that what is in the tail. All right. So what are the symptoms? There will be skin problems. There will be inflammations on the skin. All right. And that's what is known as what? Dermatitis. Dermatitis. All right. It results into what? Diabetes mellitus because there's elevated glucose. Results into weight loss. That means insulin will not be sufficient. Again, there'll be weight loss, there'll be diarrhea, there'll be abdominal pain, there'll be anemia, there'll be what? Thromboembolism. Right. So diagnosis criteria is when you check for the glucose serum levels, you find it elevated. You do imaging CT scan. That's imaging scans, so imaging test, sorry, like CT scan, MRI, PET, and you find out that there is a tumor growth in the pancreas, right? The endoscopic ultrasound and also biopsy can also help confirm further. Treatment is surgical resection using chemotherapy, using radiotherapy, using somatostatin analogs like octreotide, using glucagon receptor antagonist. Right? The complications, it could actually lead to metastasis, right? That's spreading, right? Then it could lead to what? All the glucose in the body being used up, or most of the glucose in the body being used up, resulting to what? A low glucose state in the body, right? That's what? Hypoglycemia, all right? Then pancreatic insufficiency, malabsorption, and infections, right? So that's it for what? Glucagonoma.